Hey girlfriends, there was a recent New York Times article that stated that IUD insertion was probably one of the most painful GYN procedures to occur in the office. And that's quite unfortunate considering that IUDs are the most commonly used contraception among professional women. I pride myself on trying to have a pain-free or a minimal pain IUD insertion in my office. So today, I'm going to pass along to you some of the things that I do in my office. One of the first things you can do to help with your IUD insertion starts before you even arrive, and that's with pre-medication. If you've never had a baby before, it may be very difficult for the IUD to go through the cervix. So one of the things that the doctor can do is prescribe for you a medication called misoprostol or Cytotec. What it does, it causes the uterus to squeeze a little bit, and by squeezing, it allows the cervix to open a little bit so that it's easier for the IUD to slide in. Another piece to the prescription puzzle is to have pain medicine prescribed for you before the procedure. Something like a non-steroidal anti-inflammatory like ibuprofen, but prescription strength. Maybe your clinician will also prescribe something like Tylenol 3 or hydrocodone, just one or two, to take before the procedure. The first part of the IUD placement is placing the speculum so that we can visualize the cervix. Step one is to actually choose the best speculum for you. Did you know that there are actually 3 different sizes of speculums? Not everyone has to have the medium or the large. So make sure that your clinician chooses one that can accommodate you, but still allow them to see the cervix. It doesn't necessarily have to be the large one. The next part of the procedure is to use this particular instrument here called a tenaculum. No, it does not look comfortable at all. What it allows you to do is to actually grasp the cervix so that you can straighten out the uterus. You can imagine these little pointy ends can be quite uncomfortable. So my approach to that is to use this right here. It's called hurricane gel. If you've ever had any type of dental work done and you're familiar with it, it's that sweet cherry smelling gel that we place up against the gum to numb the gum just before we get a shot. Well, it works on the cervix too. So you can use it across the surface of the cervix, but you can also use a swab at each of those points where that old pesky tenaculum will go. After waiting roughly a minute or so, those areas should be pretty numb. And then that's when we actually place the tenaculum. There are 2 approaches to placement. You can go either very slow or very fast. Very fast will usually ask the patient to take a big cough. And then it's on before you know it. But another method is to take it very, 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 very slowly. By doing those edges just kind of slowly bend into the tissue without actually puncturing the tissue, and then it's not quite as uncomfortable. But the big game changer for me is this little baby right here. This is what we call an endometrial biopsy pipelle. See these numbers here? Most of us use it so that we can measure the length of the uterus. This way we actually know how far to insert the IUD. But you know what else this instrument is? It's also a straw. And with that little straw, we use a solution that you should also see in the dentist's office. It's called lidocaine. That's actually what's in the needle the dentist used to numb your gum. Well, we can actually take that solution, place it inside of a sterile cup, and actually use our straw to draw up some of that lidocaine. With that lidocaine, we're actually able to inject it inside of the walls of the uterus. We let the lidocaine solution sit there for roughly 1 to 2 minutes. By the time you take all of the plastic and packaging off of the IUD itself, you probably used about a minute there. But then sing to yourself a song, a verse and a chorus, and then you taking up the other minute. At that point, the walls of the uterus should be quite numb. At that point, you can very easily insert the IUD, and most patients say they just feel a little cramping. Yes, I have told many of my colleagues about these little tips, and I'm proud to say that many of them have incorporated them into their insertion techniques. But you have a few who are very resistant because they say, hey, it takes a little more time, or those extra things cost money. But in my opinion, it's well worth it for this to be a painless procedure for my patients. And even if it's not painless, it shouldn't be the unimaginable pain that women have reported in that New York Times article. So you see, girlfriends, it doesn't have to be that way. Pass this video along to anyone you know who's planning to get an IUD insertion. Have their clinician incorporate these things into their placement, and it should not be as uncomfortable as you think it would be.